po, so ngayon po ay parasitology naman. Very important po yung differentiation ng tinea saginata and tinea solium. Remember yung itlog po nila or egg, magkamukha, so we cannot differentiate saginata from solium on the appearance of its egg. So ano po yung two ways para ma-differentiate ang saginata from solium, the scolex and the proglutid? Yung tinea saginata scolex, quadrate scolex, with 4 complex sucker, pero wala po siyang rostellum. Yung kay tinea solium quadrate, with 4 suckers, arm, rostellum. Another way to differentiate them is based on the appearance of the gravid proglutid or segment. Tinea saginata proglutid has 15 to 20 lateral branches in a dichotomous or tree-like arrangement. And tinea solium proglutid has 7 to 15 lateral branches, dendritic or finger-like in arrangement. Tinea saginata, 15 to 30 lateral branches in a dichotomous or tree-like arrangement. Tinea solium, 7 to 15 lateral branches, dendritic or finger-like arrangement. For Plasmodia, usually all stages can be seen in the peripheral blood film, except for Plasmodium falciparum. In the case of Plasmodium falciparum, not all stages are seen in peripheral blood. Mature trophozoite and schizon are not seen in the blood smear for Plasmodium falciparum. Cryptosporidium acoccidian, common cause of diarrhea among immunosuppressed patient, for example, yung mga patient with AIDS or HIV. So, anong concentration technique for Cryptosporidium? Formalin ethyl acetate, sedimentation technique or the Shater sugar flotation technique. For demonstration, pwede po tayong gumamit ng modified acid fasting or indirect fluorescent procedure. Tatandaan niyo po modified acid fast for coccidian. Wala pong sasagot ng modified trichrome kasi modified trichrome po for microsporidian. Cryptosporidium, modified acid fasting. Ano po yung difference nito sa original acid fast? Weaker ang decolorizer instead na hydrochloric acid, sulfuric acid po ang decolorizer ng modified acid fasting. CM, computation of crea clearance. To compute for the crea clearance, U times V divided by P. Yung U po for urine creatinine in mg per deciliter and V for urine volume in ml per minute. Yung P for plasma creatinine in mg per deciliter. Be sure bago mag-compute, tama po ang unit. Pag mali po yung unit, hindi tayo mag-arrive sa correct answer. Applicable yung first formula natin kapag yung patient po natin is of the average body surface area. Now, kung hindi po average body surface area, how do we compute for the crea clearance? U times V divided by P times 1.73 over the patient's body surface area. Normal value of crea clearance approaches 120 ml per minute for male patient 107 to 139 ml per minute, for female 87 to 107 ml per minute. Comparison of the glucose oxidase and clinitase reaction. Ang glucose oxidase, ang principal po nito, enzymatic. Ang clinitase, ang principal po nito ay copper reduction. Dahil copper reduction ng clinitase, non-specific to glucose, it will react with other reducing substances. Paano po pag ang glucose oxidase? Negative, ang clinitase positive. Now, this can indicate presence of non-glucose reducing substances. Pero paano naman po kapag ang glucose oxidase positive, ang clinitase negative? Ang glucose oxidase po, hindi lang po siya specific for glucose. It is also more sensitive to glucose. Ibig sabihin, it can detect small amounts of glucose. So, positive, glucose oxidase, negative clinic test, glucosuria, true glucosuria, indicative of a small amount of glucose. Ang glucose oxidase, ang strep, hindi lang po siya specific for glucose, but it is also more sensitive for glucose. Orthostatic or postural proteinuria, proteinuria when standing due to pressure to renal vein. Paano po ang clue for orthostatic proteinuria? Yung first morning urine po dito, negative for urine protein. Opo naman po, unless natutulog tayo na nakatayo. Urine after a period of standing, yun po yung positive for urine protein. Acid test, a test for ketone, hindi lang po ang urine ang applicable for the acid test tablet test, pwedeng gumamit ng whole blood, plasma serum aside from urine. Katulad ng reagent pad for ketone, the test will detect for acetoacetic acid and acetone. It will not react with BHA or beta-hydroxy butyric acid. Acid test, similar to ketone pad, it will react with acetoacetic acid and acetone. Ketone not detected by the acid test tablet test, BHA, beta-hydroxy butyric acid. Urobilinogen, hemoglobin degradation product. Unlike urobilin, ang urobilinogen, colorless. Ang colored pigment po yung urobilin. Normally, a small amount of urobilinogen is present in urine, less than 1 mg per deciliter or less than 1 Ehrlich's unit. Hindi po kompletong ating exam kapag hindi po tayo tinanong about sa differentiation ng 3 types of jaundice in terms of urine bilirubin and urine urobilinogen result. Both of these analytes are light sensitive, so they must be protected from light. So, ang container po ng urine dito must be amber. In hemolytic disease, ano pong bilirubin fraction ng elevated? Unconjugated bilirubin. In hepatic jaundice, unconjugated or conjugated bilirubin. In biliary obstructive jaundice, in bile duct obstruction, anong bilirubin fraction po dito? Ang elevated, conjugated bilirubin. Remember, anong bilirubin ang nag-appear sa urine? The conjugated type. In hemolytic jaundice, urine bilirubin is negative, urine urobilinogen is positive. In liver damage or in hepatic jaundice, ang urine bilirubin can be negative or positive. Kailan po ito positive? Kapag elevated na rin po, pati conjugated bilirubin. Urine urobilinogen is positive. What about in obstructive jaundice or bile duct obstruction? Remember, anong bilirubin fraction ng elevated po dito? Conjugated bilirubin. In bile duct obstruction, ang urine bilirubin is positive. Urine urobilinogen is negative or decreased. Pero bakit normal ang nakalagay? Yung strip po natin for urobilinogen, hindi po siya ginawa to detect decreased value. So kahit decrease or absent to, ang reading po na makikita natin ay normal. So sa local boards, ano yung analyte na never ni-report as negative sa urine? Urobilinogen. Remember, in a dilute urine, yung mga red cell, nagsuswell, kapag na-exceed yung capacity to swell, naghihimulay sa pong tawag dito, ghost cell. Ang tatandaan po dito, sa microscopic, wala pong nakitang blood, pero positive ang reagent strip for blood. Pwede po itong hemoglobinuria or myoglobinuria or pwede naman pong dilute urine. Therefore, walang nakita na intact red cell sa microscopic. Pwede rin pong mag-positive ang reagent strip for blood. Cholesterol, these demonstrate the characteristic multi-cross formation under polarized light. Ano po yung nag-exhibit ng multi-cross among the urine element? Oval fat bodies and fatty acids, kapag nagko-contain ng cholesterol and starch, although hindi po nagko-contain ng lipid, yung starch, when examined under a polarizing microscope, pwede rin pong mag-exhibit ng Maltese cross. Remember, yung starch po, siya po yung pinaka-common artifact sa urine and other body fluids. Saan galing yung starch? Sa mga gloves. Ang naka-picture po dito, oval-fed bodies under a polarizing microscope. Oval-fed bodies, when they contain cholesterol, will exhibit the characteristic Maltese cross formation. Yeast isolate. Pinaka-common po na yeast isolate, si Candida albicans. Common sa mga immunosuppressed, sa mga pregnant, yung mga patient receiving antibiotics for a long period, at saka yung mga patient na diabetic. Acidic ang urine, maraming glucose, favorite po ni Candida albicans. Remember, most common yeast isolate is Candida albicans. 50 to 70% Candida albicans, but only less than 20 or 20% Candida glabrata. 50 to 70% Candida albicans, 20% Candida glabrata. So 20% ng yeast isolate, Candida glabrata, and the remaining about 10% Candida tropicalis. Acute tubular necrosis, increase RTE cell in urine, and increase epithelial gas. So, in acute tubular necrosis, anong urine odor? Odorless. Sa microscopic, pwede tayo maka-encounter ng increased RTE cell, increased epithelial gas. Pwede rin po tayong maka-encounter dito ng mga bubble cells. What are bubble cells? When we say bubble cell, these are RTE cell with non-lipid containing vacuoles in acute tubular necrosis. Post-vasectomy, seminal fluid analysis. Unlike seminal fluid for fertility studies, time and temperature not critical. For post-vasectomy analysis, kailan po ito ginagawa? This is done 2 months after vasectomy and continued until 2 consecutive monthly specimens show no sperm. Ang constraint lang po natin dito, presence or absence of sperm. Presence of 1 sperm in post-vasectomy analysis is considered significant. Next po, this is a table taken from Polanski Quick Review Cards by Polanski for fertility studies. At least a 3-day abstinence without a condom, kept at room temp or body temperature, delivered to the laboratory within 1 hour of collection. For post-vasectomy analysis, time and collection is not important or not critical. This should be done 2 months after vasectomy and continued until 2 consecutive monthly specimens show no sperm. So kahit hindi po na-store sa room temp or 27, pwede pa rin po sa post-vasectomy analysis kahit po na-collect with a condom. Ang chine-check lang po natin dito, presence or absence of sperm. Paano po pag walang sperm? I-concentrate po natin, baka mamaya nakalagpas yung isang sperm, and dun sa concentrated sample, pwede natin i-check ulit for presence of a sperm. Hema, aplastic anemia. When we say aplastic anemia, pancytopenia. Depressed ang lahat ng mga blood cell. Depressed po dito ang red cell. Depressed po dito ang WBC. Depressed po dito yung platelets. Ang aplastic anemia pwedeng congenital or this can be acquired. Congenital aplastic anemia is also known as Fanconi's anemia. Congenital pancytopenia is also known as Fanconi's anemia. Now, this can be acquired exposure to radiation, certain chemicals or drugs. Remember, ano po yung drug associated with aplastic anemia? Chloramphenicol. Another, we have yung pure red cell aplasia. Ito po yung anemia lang. Mababa po dito yung RBC count, pero normal ang WBC. Normal ang platelet in pure red cell aplasia. Pero, katulad po ng aplastic anemia, pwedeng congenital or acquired. Congenital pure red cell aplasia or erythroid hypoplasia is also known as Diamond Blackfan anemia. So, ang kwento po dito, neonate, depressed yung red cell, depressed yung retic, pero normal ang WBC count, normal ang platelet count, baka case po of Diamond Blackfan anemia. Similar to aplastic anemia, the condition can also be acquired. Acquired pure red cell aplasia can be seen in some hemolytic anemias or thymoma. Another, we have yung ESR. Remember, what is the first stage of ESR? Rouleau formation. For Rouleau formation to occur, dapat normal ang shape ng red cell. Kapag nadali po yung paggawa natin ng ESR, yung mga red cell po dito nagiging parang spirocytic. Therefore, hindi magpo-form ng rouleau. Therefore, walang packing, walang sedimentation. Delay in testing, decrease ESR. Bata, naka-ingest ng naphthalene ball or mothball. Anong inclusion ang pwede ma-encounter sa kanyang red cell? Heinz. When we say Heinz, these are denatured hemoglobin. For demonstration, it requires the use of a supravital stain, for example, crystal violet. Remember, ano yung mga inclusion or elements sa hema that requires supravital staining? Reticulum ng retics, Heinz at saka hemoglobin H. Remember, for coagulation studies, blue stopper tube ang gamit natin. Sa blue stopper tube, what is the ratio of anticoagulant to blood? 1:9. Blood anticoagulant, 9:1. Kapag 4.5 ml po yung blood, ilang ml po dapat ang anticoagulant? 0.5 ml. Isisentry para makuha ang patient's platelet per plasma. Ang problem po dito, polycythemic. Maraming red cell, kakaunti yung plasma. So kapag sinentry po natin yung dugo nito, yung citrate sasama sa plasma. Isa sa mga reagent for PT, EPTT is calcium. Kapag excessive po ang citrate sa plasma, yung calcium reagent, instead na mag-a-act sa cascade, magre-react sa excess citrate. So, falsely prolong po dito yung PT at saka APTT. So, ano pong pinaka-remedy natin para dito? Reduce the amount of citrate anticoagulant. Polycythemic patient, falsely prolong ang PT, APTT because of excessive citrate in patient's plasma. So, remedy, reduce the amount of citrate anticoagulant. Ito po, sample drawn from an intravenous catheter. Walang po yung EPTT, so ano maaaring cause po nito pag kinulit from an IV catheter? Heparin contam. Ang pang-flush po kasi nito ay heparin. From an IV catheter, walang EPTT, ano pong pwede natin gawin? Pwede po tayong mag-perform after ng EPTT, pwede po tayong mag-perform ng thrombin time. At kapag pa lang po ang thrombin time, maaaring heparin contam. So, pwede po nating inutilize yung heparin with heparinase or Hebzyme. A flowchart from RUDOC. EPTT is prolonged. What to do next? Thrombin time. So, maaaring heparin contam. So, pwede inutilize yung heparin with heparinase or Hebzyme. Kapag ka-neutralize with heparinase, uulitin po yung EPTT Kapag nag-normalize, sure po tayo, ang cause po nito, heparin contam. Paano naman po pag prolong yung APTT at normal yung thrombin time? Pwede na po tayo mag-perform ng mixing studies. Kapag wala pong correction yung mixing studies, even with the normal plasma, this indicate presence of a circulating anticoagulant. An example of a circulating anticoagulant, the lupus anticoagulant. Again, blood from an IV catheter, walang APTT, maaari pong heparin contam. So, pwede po tayong mag-test ng thrombin time para i-check po kung heparin contam. Kapag walang po yung thrombin time, pwedeng i-neutralize with heparinase or Hemzyme. Increase yung WBC sa microscopic, nakakita po tayo ng mga caudazite and hemoglobin C crystal. Bakit increase po dito yung WBC? Because of the presence of abnormal hemoglobin, hemoglobin S or hemoglobin C. RBC containing abnormal hemoglobin such as S or C or resistant to lysis. Therefore, they are falsely counted as WBC and may interfere with hemoglobin reaction. So, pwede po tayong mag-manual count ng WBC with prolonged incubation with the diluent. Lyse-resistant red cell due to presence of abnormal hemoglobin such as hemoglobin C, remedy manual WBC count with prolonged incubation with the WBC diluent. Hashimoto's thyroiditis, ang patient po dito ay hypothyroid, depressed state 3, depressed state 4. Patient with Hashimoto's thyroiditis will exhibit presence of antimicrosomal antibodies and anti-thyroglobulin. Antimicrosomal antibodies are also known as anti-TPO or thyroid peroxidase antibody. 90% patient with Hashimoto's thyroiditis exhibit the presence of anti-TPO and 20 to 50% exhibit the presence of anti-thyroglobulin. Alzheimer's, double diffusion. Bakit po tinawag na double diffusion? Because antigen and antibody diffuse independently through the medium. Formation of a smooth curve, ibig sabihin the antibodies precipitating two similar antigen. Identity. Now, formation of two cross lines, non-identity, meaning the antibodies precipitating different antigen. Spur formation, partial identity. The antibodies precipitating different antigen but with a common determinant. Passive and reverse passive agglutination, parehas po silang gumagamit ng carrier particle. In passive agglutination, yung carrier particle po is coated with antigen. For example, latex particle coated with an antigen. Ano pong dinidetect ng passive agglutination? Agglutination will occur in the presence of the corresponding antibody. Pag sinabi naman pong reverse passive agglutination, yung carrier particle po dito is coated with an antibody. Yung antibody po must be attached in a manner wherein yung mga antigen binding site are active and available. Reverse passive agglutination, therefore, detects for presence of the corresponding antigen. Ito na po. The AT test will detect in vivo sensitization of the red cell. So, ang first po na gagawin natin, polyspecific EEG. DAT test with the use of a polyspecific EEG. Polyspecific EEG because it contains anti-IgG and anti-C3d. Kapag nag-positive po sa polyspecific EEG, magpa-perform po tayo ng DAT test using a monospecific anti-IgG or a monospecific anti-C3d. Inuulit ko, polyspecific po muna. Pag nag-positive, tsaka po tayo magpo-perform ng monospecific EEG test. Para malaman po natin kung ang present po ba ay IgG or C3d. Kapag nag-positive po for anti-IgG, ibig sabihin present po yung IgG antibodies na nakakoat sa red cell. So, what to do next? Pwede po tayo mag-perform dito ng elution. Pag sinabi pong elution, breaking of bonds between antigen and antibody. Bakit? Kasi i-identify na po natin yung antibody coating the red cell. Again, kapag nag-positive with anti-IgG, ibig sabihin po, may IgG na nakakoat sa red cell. So, gusto natin malaman ano ba yung antibody coating the red cell. So, what to do next? Pwede po tayong mag-perform ng elution, breaking of bonds between antigen and antibody para ma-identify na po natin yung IgG antibody coating the red cell. Paano naman po kapag nag-positive with C3d or anti-C3d? Ang una pong explanation, malamang lahat ng red cell nag-immunize kaya wala na po tayong madetect na sensitizing IgG antibodies, or usually, this can indicate presence of IgM or a cold antibody. So, just in case, tanungin po tayo, negative anti-IgG, positive for anti-C3d. Now, this can indicate presence of cold antibodies. What to do next? Pwede nating i-warm to verify kung ang present ba mga cold antibodies or IgM antibodies coating the red cell. The DET test will detect for in vivo sensitization of red cell. Una muna, polyspecific. A polyspecific EEG reagent contains anti-IgG and anti-C3d. Kapag nag-positive po yung polyspecific, magpo-perform po tayo ng monospecific DET test with a monospecific EEG reagent, anti-IgG or anti-C3d. Kapag nag-positive po with anti-IgG, ang next step is elution. So, breaking of bonds between antigen and antibodies para malaman na po natin yung IgG antibody coating the red cell. Paano po pag negative with anti-IgG but positive for anti-C3d? Usually, pag ganito po, now this can indicate presence of cold antibodies IgM. So, ang next step to verify the presence of cold antibodies, warming. Warming techniques. Paano nyo po i-blood type yung red cell na DET positive? Siyempre, kung may nakakoat na antibody, hindi natin mabablood type accurately yung red cell. So, ano pong pwedeng gawin? Pwedeng i-treat yung red cell ng chloroquine diphosphate. It dissociates IgG from red cell with little or no damage to the red cell membrane. Actually, there are two reagents for stripping the antibody from the red cell surface while leaving the membrane intact to allow phenotyping of red cell. Chloroquine diphosphate as an acid glycine ETA. So, paano mo i-phenotype yung red cell coated with antibodies? Pwedeng i-treat with chloroquine diphosphate and acid glycine ETA. Kapag negative yung DET test or EEG test, kailangan pong muna natin i-confirm. Paano i-confirm? Sa negative tube, mag-add po tayo ng check cells or com cells. What are check cells or com cells? These are group of red cell coated with IgG. For a test to be valid with check cells or com cells, dapat po mag-exhibit ng agglutination. Paano po pag walang agglutination with check cells or com cells? The test is considered invalid. Ano po yung 3 reason dito? Maaring kaya walang reaction kasi hindi mo na-add ang EEG reagent, na-neutralize or na-inactivate ang EEG reagent or insufficient washing. Insufficient washing. Unbound globulins can neutralize the EEG reagent, thus false negative tests. Type 1 hypersensitivity reaction, bronchial asthma, food allergy. Anong immune mediator po nito? IgE. For measurement of total IgE, we have yung risk. For measurement of antigen, allergen-specific IgE, RAS, Regio-Allergic Test. Pag walang RAS, parang R, pwede po tayong sumagot ng FAST. fluorescent allergosorbent test for determination of allergen or antigen-specific IgE, for measurement of total IgE risk, for measurement of antigen allergen-specific IgE RAS. Pag walang RAS, pwede po tayong sumagot ng FAS. Remember, para sa test for syphilis, we have the non-treponemal test and the treponemal test. The non-treponemal test detects for aging. The treponemal test detects for treponemal antibodies. Yung treponemal antibodies po for life, kahit treated na po yung patient, magpapositive pa rin po for treponemal antibodies. Yung non-treponemal test, they detect for re-aging. Yung re-aging po nagde-decline sa latter part ng syphilis, even faster sa mga patient receiving treatment. Ano daw po yung test na pwedeng gawin to assess reinfection? Syphilis reinfection, non-treponemal test. Katulad na na-mention ko, yung re-aging po, nade-decline even faster sa mga patient receiving treatment. Pero, paano pag tumaas po ulit to? So, pag tumaas ulit, maaring treatment failure, an indication of treatment failure, or an indication of reinfection. So, for reinfection, syphilis reinfection, non-treponemal test, ano pong halimbawa nito? VDRL test, RPR test. For HEPA A, remember, detectable sa stool ang HEPA A virus RNA, and then IgM, anti-HEPA A virus antibody, and IgG, anti-HEPA A virus antibody. IgM for active or acute HEPA A, IgG for past infection with HEPA A. Remember, ang HIV under ng retroviruses, under family Retroviridae, we have human T lymphotrophic virus 1, 2, and 3. 3 is HIV. Human T lymphotrophic virus 1 is associated with T-cell leukemia lymphoma. Human T lymphotrophic virus 2, infection with disease is unclear. Most individuals with HTLV2 are asymptomatic, although sa DB na mention, common ito sa mga drug abuser. Similar to HIV antibodies, ang initial test po is ELISA. Kapag nag-positive ang ELISA, parang test for HIV, repeat ELISA. Reactive ELISA should be retested with ELISA bago po mag-perform ng confirmatory test like Western blot. So, ELISA test, screening, kapag nag-positive, repeat ELISA. Kapag nag-positive, tsaka magpo-perform ng confirmatory test. Example, the Western blot test. Appearance of HIV marker, inulit ko, maaaring P24 ang unang antigen. Pero ano po yung first detectable marker of HIV infection? Viral RNA. Next na lang po yung antigen, and then IgM and IgG antibody. Western blot. Nung araw po, ito po yung CDC recommended confirmatory test for diagnosis of HIV. Pero dahil matagal po ang result nito, 7 to 21 days, hindi na po ito ang CDC recommended test. Pero pag-usapan pa rin po natin yung Western blot. Positive Western blot, presence of at least 2 out of 3 possible antibody band to P24, GP41, and GP120 or 160. Pag wala pong band, negative. 2 out of 3, positive. Paano pag iisa lang? Indeterminate. Pag indeterminate po, pwede pong ulitin po ulit. Pag indeterminate pa rin, pwede po siyang ulitin after few weeks. Ang iniisip po natin dito ay early infection. Kaya po wala po pong na-detect na antibodies. Paano pag indeterminate pa rin after few weeks? considered na po yun as false positive Western blot. No band. The test is considered negative. 2 out of 3 antibody bands, at least 2 out of 3 antibody bands to P24, GP41, GP120, or 160 is positive. Pag iisa lang out of these 3, indeterminate. Pag indeterminate, ulitin. Pag indeterminate pa rin, repeat after a few weeks. After a few weeks, indeterminate pa rin. So, false positive Western blot test for HIV. Congenital toxoplasmosis. Ingat po sa torches or storage, lalo na po yung mga pregnant, pwede po itong mag-cause ng anomalies unborn child. Toxoplasmosis, rubella, cytomegalovirus, herpes, and syphilis. Diagnosis of congenital toxoplasmosis. Neonate with congenital toxoplasmosis usually have detectable IgM antibodies. For confirmation, demonstration of an elevated IgM titer in mother's serum. To confirm for congenital toxoplasmosis, demonstration of elevated IgM titer in mother's serum. Further support diagnosis of congenital toxoplasmosis. Hanggang dito po muna. Another video naman po itong RH Light Typing. Salamat!